I gave a presentation yesterday on health-related quality of life for people with type 1 diabetes from early childhood all the way up through late adulthood, and not just for people with diabetes, but also for their caregivers, their parents and partners. We don't assess their quality of life enough, and they have it. Our goal of doing this research is to understand that quality of life is really important, that it's just as important as glycemic control, and that we don't have rigorous methods to measure it. And so the purpose of the project we've been doing is to develop a series of measures that assess health-related quality of life specific to having diabetes at different points in your life. So how we assess it's different if you're in preschool or high school or old age. So we've done a lot of things over the last year. We have interviewed 81 people to ask them about their quality of life, and then we rigorously analyzed the interviews that we had with them, and from what we learned from people through those conversations, created measures, questionnaires, surveys, and then had people read those surveys and tell us what they thought of them, so that we could make them a little bit better. And now we have 14 different versions of this survey for all these different age ranges, and whether you're a person with diabetes or their partner or their parent. And so starting next week, we're actually starting to collect data from 3,600 people with diabetes across the country so that we can test the psychometric properties of the measures and determine if they're functional and make sure that they're good to be used in clinical care and also in clinical trials research. I'm a pediatric psychologist, and so I mostly work with people with type 1 diabetes and their families, but unfortunately we do have quite a few young people with type 2 diabetes, and across the lifespan, we have people with both. Some of the things we use to talk to people with diabetes about their quality of life are very much the same. It's asking an open-ended question with sincere curiosity about someone's experience, and listening. And so that doesn't differ whether you have type 1 or type 2 diabetes. I think some of the specific questions we ask about how your treatment impacts, for example, your family life or impacts the activities you do, those differ by the type of diabetes that you have. Parents of kids with diabetes, whether or not they want to think about their child having diabetes, do not have a break from thinking about their child having diabetes. It is with them from the moment they wake up, through breakfast, through getting ready for school, through getting to school, through PE, through everything they do, and it doesn't end when they go to bed. They think about their child having diabetes overnight, and then it starts again the next day. It doesn't stop. And so I'm less concerned about us asking questions that are going to remind their parents that their kid has diabetes, and it's much more about creating a tool that providers and researchers and policymakers can use to say, hey, your quality of life matters. You're more than just your A1C. I want to know what it's like to live as the parent of a child with diabetes, and here's a way I can assess that in a quantitative fashion so that I can do some quantitative, really rigorous research around it, or so that I can, as a doctor, say, oh, I see that your quality of life has improved in this way or decreased in this way. So that's why we ask the questions. Yeah, absolutely. I think there's some similarities, right? So when we interviewed people with the partners of people with diabetes and the parents of younger people with diabetes, some things came through very commonly across the different kinds of supporters. We heard about worry a lot. We heard about fear of hypoglycemia a lot. We heard about needing to work together and support the person with diabetes and work together as a family a lot. There are some unique issues though. So parents of kids think a lot more about school and think a lot more about friendships, whereas partners of adults might think more about finances and might think more about retirement and family planning. And so there's sort of some commonalities across ages, and then there's some really unique constructs that emerge at different points in life. So for the measures we created, we really tried to do this developmental tailoring so that we can measure quality of life as it is relevant to kids and as it is relevant to older people and then to their partners. The reason we're creating this measure is not to quantify things. It will help with that, and we need to be able to quantify quality of life. But the reason we're creating the quality of life measure is so that providers can have that conversation with their patients, so that they can say, tell me about your quality of life and how can I help you? I'm here to help you adjust your dose, and I'm here to help you make sure that we are analyzing your blood glucose trends, but I'm also here to help you live a happy, healthy, long, productive, wonderful life with diabetes. We all want a cure, absolutely. And until that happens, what we really want is to be able to support people with diabetes and help them live that long, happy, healthy, productive, wonderful life. And so as psychologists and behavioral scientists and behavioral health specialists, our job is to advocate for patients' needs, people with diabetes needs, their families' needs, to make sure that their care teams remember that they're more than just an A1C, and to make sure that payers fund the kinds of professionals that can help with that kind of stuff. So psychologists are very poorly reimbursed for our time that we spend with patients and families. And that's a huge problem because it means that diabetes centers can't hire us. And then that means that people can't reach us. And so that's a huge gap. And so that's the future of care, I think, is really advocating for psychologists to be able to be integrated into care teams, not just to address things like depression, although that's extremely important, but also to address quality of life and to address, to help people adhere to the very demanding treatment regimen, that kind of stuff.